Good evening. We begin tonight with the growing HIV/AIDS epidemic in the United States. From the 1981 to 1990, over 100,000 deaths were reported from AIDS, with nearly one-third occurring in the 1990s alone. By 1988, HIV and AIDS had become the third leading cause of death among men aged 25 to 44, surpassing heart disease and cancer. Among women, it ranked 8th with a projection shown it could soon be among the top 5. In May of 1982, the New York Times first used the term GRID, gay-related immune deficiency, to describe this epidemic. This term contributed to the growing perception that HIV was a gay man's disease, deepened the stigma and hindering the broader understanding of the virus. By 1983, the media coverage included panic over the blood supply and closing bathhouses and government response. I interviewed Dr. James Curran a couple minutes ago, and he was saying that we're calling this for an increased testing for safer practice. The focus must be on the entire population and not just one group. As the virus spreads, public health officials emphasize the need for awareness and prevention efforts across all communities. This remains a critical health issue.
To take a closer look at the response in which we affected the HIV epidemic, cities like San Francisco led the charge, pioneering community-based healthcare approaches, the creation of programs like needle exchanges, and an early push for antiretroviral therapies not only saved lives, but also laid the groundwork for modern public health strategies. These efforts weren't without challenges. Breaking through stigma and social barriers required bold advocacy and at times social and civil disobedience. Fast forward to today, where advancements in combination of therapies have turned HIV from a fatal diagnosis into a manageable condition. The lessons learned during the crisis revolutionized how we approach emerging diseases, emphasizing community involvement, cultural competency, and equitable care for all. These principles are now the cornerstone of healthcare, shaping responses to crisis from COVID-19 to the opioid epidemic. But the fight against HIV isn't over. Disparities in access to care, lingering stigmas still impact vulnerable communities. However, early victories taught us the power of advocacy and innovation. They remind us that progress is possible when we combine science, compassion, and the voices of those who are directly affected.
Hello everyone, I'll be covering the various facilitators of HIV and the AIDS epidemic during the 1981 and 1990s crisis. So during the early years of the HIV epidemic, stigma was a major barrier. The disease was strongly labeled as a gay plague, leading to fear, discrimination, and government inaction. Public officials delayed acknowledging the crisis, and there was a minimal funding for research, prevention, and treatment. The article by Robert J. Vigar and Philip S. Rosenberg titled HIV Infection, AIDS in the United States during the 1990s highlights the minority community, especially the LGBTQ+ groups and people of color, face systemic healthcare inequalities, making access to care much more difficult. In response to affected communities, they began to take action, and these brought up the rise of grassroots organizations like the ACTA, which stands for AIDS Coalition and Unleash Power, and the GMHC, the Gay Men's Health Crisis, provided care, raised awareness, and demanded government accountability. Their activism brought attention to the crisis, challenged stigma, and pushed for policies like the Ryan White Care Act of 1990, which provided essential funding for the treatment of HIV. These communities-driven efforts, combined with early treatment advances, laid the foundation for progress. Despite the barriers, resilience, and advocacy for these communities that were critical in pressuring the government to act and saving countless lives. Thank you.
2, 3, go. Okay, I'm going to be discussing the lessons learned about the integration of HIV into the border healthcare system. The integration of HIV in the health systems helps develop the response to HIV and health outcomes. The HIV testing is offered by blood, antigen, and antibody tests. The ELISA test is one of the first HIV blood tests that came out in about 1981. In 1981, the scientists started working with AIDS specimens to try to determine how this illness compromises one's immune system. So with one's reaction of the blood with the different with the reaction of one's blood with different enzymes can indicate the HIV antibody test is positive. The HIV epidemic has brought universal precautions such as proper hand hygiene, wearing gloves to protect from blood and body fluids, proper needle handling and disposing, and most importantly, safe sexual education.